community emailing list and say, okay, I need this functionality, and then to rely on some programmers that would be available to provide you this functionality. And one of the also major barriers is that executives are lacking the knowledge about the benefits of loss. Yeah, actually there was a very interesting paper in Canada, and they have found out that the key factors for not adopting open source solutions were closely linked to the orientations of ministry-level policymakers and a seeming lack of information on the part of operational-level IT managers concerning commercially oriented open source providers. I have shown you this paper because of in Canada they have really several very good FLOSS applications, but in this study they have more or less found out this, and this is also something what I wanted to say is that even if you have good systems, you also need the support of a policy that these solutions can be adopted. And there's also a need for a certification of such systems. So this is more or less a very brief overview of the specifics in healthcare, and now I would go into some real-world examples from healthcare side, and I would try to go as quick as possible through these examples. As I already addressed, in Canada they have the OSCAR system. It's a very interesting system. It's developed at the McMaster University, mainly from David Chan, and it's a system, an electronic healthcare record system, or a system for family physicians. And this system is now used by more than 700 family physicians in Canada, and they really managed to set up also companies that provide the professional support services for their customers. So what they do is they sell the hardware at a very reasonable price, and the software comes for free, and these companies do their living on selling the support services. Another application is Open Clinica. It's a system used in clinical research from a company from the US. And as you can see, they have really managed to set up a community of users. I'm not sure about how much the community also commits code, but at least it's a very big user community, and definitely they will get back the valuable feedback to improve their solution. This is just another system which is very successful. It's an imaging software developed at the University in Geneva. And this is also from the radiology domain. It's a system developed in Canada, in Toronto, and this is also an example of this single vendor open source, what we heard yesterday. It is done by a small company with 8 developers, and they have something like 700,000 lines of code. And the CIO and the CEO of this company told me that the community or the commitment of the community concerning the code is less than 1%. So most of this code has been done by these developers. And it's a really professional solution for radiology and picture archiving in medicine. A very big area is also what is called mHealth, mobile health, and there is a huge amount of systems already outside despite the fact that these mobile systems are very young. And also a lot of non-governmental organizations are trying to use this technology in developing countries to reach the people and to bring healthcare to the people. Another very interesting application is the iPass solution. It's a telemedical platform originally started in pathology, and they also managed to grow an active user community with over 4,000 users. And basically they have installations all around the world, and the main application is that the users can form specialist groups, like in pathology or also in orthopedics, cardiology, and then to share or to ask for a specialist advice and for a second opinion. And this is specifically important for developing countries where they have a lack of specialists. They can load up their slides to this central server and ask for advice from other countries or from specialists all around the world. A very famous system is the Vista system from the US. It has been developed around 20 years ago, and actually from the Veterans Health Information Systems, and they were facing a major challenge. They had to serve more patients with the same amount of money and to improve their quality. And this system is available under open source in different versions right now. And it is used in more than 163 hospitals, 850 clinics, and so on. And I will skip through these slides. And this is one of the systems where we really have clinical evidence that this system is meaningful and has provided the users with a very useful system, and which was able to also to lower the mortality rates and to improve the quality. And there's also financial evidence that this IT investment has really a return of investment, and you can have more information on this in this Health Affairs 29 from this year. Yeah, and one of the systems that have grown out of this is the World Vista Systems, and I would like to bring to attention to you this project, which is in your region here in Jordan, and they are trying to adopt this World Vista approach and build a national health system that spans over 46 hospitals, I think, and 1,000 clinics. And the strategy is to maximize the knowledge transfer. So they decided not to adopt too much in the system. They wanted to bring in the Arab language support, and the major focus is on applying the system as it is. OpenMRS is a very big community in Africa. It started in the United States, and the Regent Street Institute is supported by the Rockefeller Foundation, and in Canada the IDRC. And as you can see on the picture from the Implementers Conference, they were also successful in growing a very big implementer community. Medical is a system started in Argentina, and it was a project of the month on SourceForge. And there the approach is to build a universal hospital information system, mainly for developing countries, and it is based on Open ERP, an open enterprise resource planning solution that is used in more than 45 countries, and has also a very big user community. So the main advantage in this system is that because of this broad user community, you have a lot of people that are familiar with the system. It's based on Python, and it's a very modular system, and you can put on a kind of medical stack on top of this basic functionality.